Good afternoon, and thank you for joining me. This is Irene Etzkorn, Chief Clarity Officer at Siegelvision. We're here today to talk about simplifying health-related information, in particular, how to communicate with clarity through empathy. I'll briefly explain who I am and the fact that I wrote a book about simplicity, so this topic is near and dear to my heart. I co-authored the book with the CEO of Siegelvision and a person whom I have worked with for 4 decades. Our book is entitled Simple: Conquering the Crisis of Complexity. And we wrote that book because at Siegelvision, we believe complexity is the greatest barrier to progress. We help causes, organizations, companies achieve clarity of purpose, clarity of expression, and clarity of experience. And today we're focusing on that last one, clarity of experience. We've pioneered the simplification in a number of industries where we have developed the first. And that has meant in the area of finance, insurance, telecommunications. For example, some of you may not realize that the concept of an easy form did not always exist at the IRS, nor did Wall Street have an investor-friendly statement. There was a time when stocks and bonds were not separated into asset classes on a statement, nor was the balance from month to month shown. All of these now are accepted as baseline information, and I think there's a similar opportunity in healthcare for us to create new baselines as table stakes for information in the healthcare arena. Basically, I believe complexity is a thief that must be apprehended. It robs us of time, patience, understanding, money, and optimism. And that's both as business people and as consumers. And this has become an increasingly pressing problem in today's complicated world. Something as simple as shopping in a pharmacy or a grocery confronts us with differences we can't discern, where we feel intimidated, overwhelmed, and very often the experience is that we feel there is something wrong with our ability to process the information, when in fact there is simply too much of it. And experiences that were once mundane or routine, such as taking a flight on an airplane, now raise anxiety. We have to prepare. We feel that there are things we don't anticipate. All of this is really the concept of empathizing, thinking ahead to what the experience of the person will be in the given context. Health information is particularly confusing and intimidating. And this is at several different levels. Certainly in terms of medical jargon, actually understanding the illness or disease. Certainly in terms of understanding the treatments and medications associated. This can even be with dental procedures. And certainly in terms of understanding the cost and the insurance associated with healthcare. A recent New York Times headline in January summed it up nicely. Hospitals must now post prices, but it may take a brain surgeon to decipher them. And sometimes it's critical information. Healthcare instructions that we can't follow can have dire consequences. This is an example of well-intentioned instructions where photographs were not used. This is the context of a feeding tube for a child. So this would certainly be something where a parent would want to fully understand these instructions. Yet, when you look at these illustrations, you realize the hand is larger than the patient's stomach. In reality, the feeding syringe is 7 times larger than the flushing syringe, but that's not reflected in the illustrations. They also tried to use the dime as a size metaphor, but its placement against the skin is not clear. They really intend you to understand its height when it's placed laterally. But none of that comes across quickly and easily. And you can certainly anticipate that the individual trying to follow these instructions might feel frustrated, anxious, or overwhelmed. When we are confronted with choices, research has shown again and again that too many choices makes us dissatisfied with whatever we choose. It's that feeling that, quote, the good one got away. And when we have choices we can't make, it can have very specific consequences. The number of tens of thousands of diagnostic codes from Medicare and Medicaid services has a practical implication. These codes affect reimbursement. And if the code is not correctly selected for the procedure, it will have this unfortunate ripple effect where payment will not come in appropriately and insurance will not reimburse. Very often, companies have unrealistic expectations of both the time and the effort that a customer is willing or likely to make in interacting with them. In an insurance company, for example, they thought it would make sense to say to the policyholder, use this contact information if your policy begins with, and then gave them this rather absurd list of digits and alphanumerics, and you were supposed to see if your policy number was anything like these, and then use a specific contact number. Very much showing through the structure of the organization, but not in a way that makes any sense to the customer. And of course, at the very fundamental level of the language, if we can't decipher it, we're stymied from the outset. And this can be both specialized terminology or more seemingly familiar terminology. For example, on this list, comfort care would seem to be a very straightforward term. However, I wonder if lay people will actually see a distinction between that and palliative care. Are they the same? Are they different? What would you be agreeing to if you chose one or the other? And whenever there is too much data with too little context, we are not really achieving our ends. This is particularly true in science and medicine. I receive this myself at home from my local water authority. I live on Long Island, as you can see, and it was intended, of course, to reassure me that the drinking water supply in my area was, in fact, clean and healthy. However, I didn't get that feeling. This is a classic case of an information graphic gone awry. The combination of color coding as well as numbering distribution areas, then overlaying another level of water districts, and all of this fine print made me, in fact, very concerned that there was something to hide. And that, we have found through research, is a common reaction. The use of plain language and clear graphics makes individuals believe that the company or organization that put them forth is honest and trustworthy. Conversely, something that is complex, complicated, and intimidating often is thought of as a company that is trying to hide something. And when you have reams of statistics, they are hard to decipher without context. In the arena of healthcare, these are attributes that one is supposed to consider in evaluating a nursing home and their care. However, without any frame of reference, you don't really know what percentage would be a norm, nor do you know which of these is the most significant. For example, percent of patients who received an antipsychotic medication. Is that a reflection on the care, or is it a reflection on the type of patients that they care for? In this case, I would want some context to understand which of these should have the most credence. And in our current environment, consumers are becoming much more vocal through social media. So things that would never have been expressed in a community setting are now immediately tweeted out or otherwise distributed, such as this comment about this person's anger over the wait time in a doctor's office. It immediately can become viral, and it can take on a life of its own, and certainly bring to the fore something that would in the past have merely been an occasional comment. So what we're talking about here is how do you move from paper-based, complicated, impersonal, and uneven communications to more digital, simple, customized, and consistent communication. So what we're looking for are the root causes of complexity. Why is the patient experience so complicated? Well, we've mentioned the medical community speaking to itself, which is a rather nuanced issue because professionals who have had years of training feel sometimes that medical jargon and the ability to understand and use it is a badge of honor or distinction, and they are loath to give it up. Certainly, illness by definition is an unfamiliar, infrequently occurring, life-changing event, and people are often overwhelmed emotionally at the time and therefore find it hard to take in concrete information and think logically. And adherence to old processes. We're at an interesting juncture where in some ways technology is outstripping our ability to connect technologies. So you have many, many reports trapped in different systems that are not yet accessible through a single interface. A lack of empathy with the emotional toll on patients and their families is another issue. It may seem perfectly fine in a conference room or even a usability lab when you're trying out a certain technology or a certain user interface, but understanding the myriad number of users and the different relationships in a family when someone is ill may change the utility of that item. And certainly many healthcare companies lack communications expertise in plain language writing, information design, and information architecture, which are key components to the solution. Basically, what we are asking ourselves is, are we communicating in the right way, at the right time, with the right information? All of these factors are critical: timing, media, and content. We believe that all simplification boils down to three key principles, and that there is a certain sequence to these. The first is empathy, perceiving others' needs and expectations. Then distilling, winnowing down, customizing what's being offered to meet those audience needs. That very often involves taking a very severe brush to the amount of existing information, going back to a blank slate and reconsidering from the audience perspective what information is critical, what is nice to know, and what can be eliminated. And then we get to clarifying the writing in plain language, the clear design, the good information architecture. Very often we are asked by clients to begin in that third area, clarifying. But in fact, if the other two have not been adequately covered, you will never be able to compensate if you don't really know what your audience expectations and abilities are. But when those three are done in the proper sequence, we believe that what they lead to is breakthrough simplicity. So let's look at some good examples, more of the right way to achieve each of these. In terms of empathizing, we believe in mapping the actual patient journey. Now, for example, in a nursing home or a hospital, this can actually be accomplished by speaking to perhaps as few as 10 patients and actually interviewing them to understand in those critical first few days, even first few hours of their care, what their experience was. I'm not a fan of journey maps that are so complicated in themselves that they are puzzles. Something like this, where we're indicating high and low points, as indicated here by the X's, minuses, and pluses, show you where someone felt that they were being forgotten, that they were not getting significant information, where in their eyes treatment was inappropriate or at the wrong time. But on the positive, it also indicates where they felt an interaction was particularly meaningful or reassuring. And it gives you insight into how you can achieve potentially a wow factor for that patient. It is equally important to also map the employee journey. So instead of mapping it over a series of days for the nurses and nurses' aides, we map it against a shift. Now, obviously, this is a composite of what we heard from speaking to many people with the same role. But we heard consistently things that we could then act on. For example, introducing myself as your aide in charge of your room, we heard over and over, was more communicative than saying, I'm a CNA, which is unfamiliar to some patients. Consistently, we heard that patients were asking, when am I going to go to physical therapy? What's my rehab schedule? When that aide didn't have access to that information, it made the patient anxious and it made the patient feel uninformed. So picking up on these key critical moments can actually be done in a relatively short period of time, interviewing relatively few people and mapping it in a relatively easy manner. Of course, Cleveland Clinic is probably the bellwether for applying empathy to the hospital setting. They have thought through absolutely every aspect of the patient experience, from the aroma in the air of the hospital to the security staff, which is invisible but quite present, to the naming of all of their employees, from CEO to housekeeper, as caregiver on their badges, as you see emulated here by Mount Sinai. It's a reminder to everyone every day that that's their primary mission as an employee. It's also reflected in the fact that they have employee dashboards where all surgeons, doctors, etc., can see their results in the context of all of their colleagues, creating a sort of tacit peer pressure to compare oneself to others. It also is reflected in their hiring practices. They actually have a certain protocol that they use to evaluate the inherent empathy of an applicant. And foreseeing the context of use through ethnographic research can be very important. Deborah Adler, a graphic designer, learned this the hard way when her own grandparents mixed up their medicines. She realized that better graphic design and product design could overcome that. It was ultimately a format adopted by Target. It used color-coded rings for different members of the family, so grandma and grandpa would know that they were the yellow or the purple. And it used a physical design where the label was easier to read. It didn't wrap around side to side. It went over the top of the container, and obviously had the name and the dosage, etc., more clearly laid out. In terms of distilling information, that customization is critical. Using what you already know about someone allows you to make the information more specific and more relevant, and therefore more understandable and more likely to be acted upon. A good example of this winnowing or distillation is a surgical safety checklist developed by a surgeon and now adopted by the World Health Organization. It summarized all of these critical steps that needed to happen from sign-in through prep for surgery and through leaving the operating room. Now, it certainly functions in terms of condensing the information, but it also was introduced with the context that anyone in the OR, regardless of their function, could stop the surgery if they felt one of these critical steps had been overlooked. It had an empowering effect in addition to a very pragmatic use. Sometimes the answer is to make the product itself foolproof or to anticipate what a concern will be. So, for example, when Philips introduced defibrillators, they found that many people were loath to use them because they were concerned in the testing of these products that they might harm someone as opposed to help them if the person wasn't actually their heart had not actually stopped. By making it where the device detects that heart rhythm and won't allow itself to be used if the person's heart hasn't stopped, you can avoid that and make people comfortable that they will not harm someone. Again, context of use came up in this design, where practically speaking, a first aid kit, if you're trying to administer it yourself, you may need to use it with only one hand available. Everything about this item here is geared toward that circumstance. And that's something that you only anticipate by actually looking at the circumstance of use. For example, there's the famous failure of the Ford automobile in-car navigation system, where it looked wonderful when tested in a usability lab, but it failed miserably when it was out on the road because it was not intuitive where the placement was for certain key buttons where people anticipated it to be so that they could punch them or touch the screen without having to look away from the road. In terms of clarifying, making the offer easier to understand, use, and benefit from, this very often has quite a bit to do with the quantity and quality of the text. Writing in plain language means certainly all of the usual use of active sentences where possible, familiar vocabulary, shorter sentences, etc. But it also means looking at something like the passage on the left and saying, this is actually a mathematical equation. So then rewriting it in such a way that visually it also looks like a mathematical equation. And the person would have a better likelihood of understanding that they are promising to pay an amount that is comprised of these components. Similarly, in an admission agreement for a healthcare institution, an issue that came up again and again is the topic of bed retention policy. If someone is in a nursing home, they very often have the false expectation that if they need to leave and go to a hospital, that they're going to come back to the specific bed and room that they had been staying in the nursing home. Reading this is, first of all, unlikely to be read because of its presentation, but it also doesn't clearly convey that. In a rewrite, this example more clearly calls out and more overtly states that it's unlikely you are going to be given the same bed, and that there are certain issues such as whether you are a Medicaid patient or if you will be hospitalized for more than 15 days, which will affect that likelihood. So it's a combination of the writing and the design and the consideration of which policies will be of paramount interest to patients. And certainly the power of information design should not be overlooked. The combination of catching someone's attention through a graphic and then providing substantive information can very often be the most powerful, as in this poster relating to stopping smoking. It quickly catches your attention and then tells you very useful information about how within the first number of hours, stopping smoking can have a beneficial effect on your body. And very often, reporting information is viewed as a necessary evil, when in fact, it needs to tell a story. So for example, in this situation, a new kind of blood test, which probably has extremely important value and significance, the materials associated with it had a questionnaire, which literally took 90 minutes to complete, was unrealistically detailed, then resulted in 20 pages of a lifestyle report and 44 pages of a treatment plan, in addition to a set of lab results for the physicians. The quantity of information here, coupled with its uninviting presentation, could easily have stopped this product in its tracks. By rethinking that content, winnowing it down, clearly dividing the the diagnostic report and the lifestyle report into two, and personalizing it, it made it a much more inviting and useful piece of information. And at a more granular level, using the red, green, and yellow to quickly draw people's attention to areas of interest and significance, as well as using a strong design grid and a winnowing down of the number of items reported, will make this information more likely to be acted upon and more engaging. And very often we find that when individuals try to use graphics, they either use too many or they don't appropriately match the type of graphic to the story to be told. So for example, pie charts, donut charts, and 3 kinds of bar charts have different functions, as do line charts and maps. It's important to match what you want the significance of the takeaway to be for the reader to the type of graphic that you use. So we've talked about what makes a patient experience difficult. What makes a good patient experience? It's rather fundamental. We think it begins with informing me, setting clear expectations. If there are circumstances where you know you will probably fall short of what a patient might expect, as with the bed retention policy, be clear about it, explain it up front. Don't wait for the missed opportunity. Anticipating needs and concerns, and speaking and writing in plain language, and asking for feedback to ensure that people have understood. Knowing me, providing seamless handoffs during care transitions. For patients, it can be very disturbing if they feel that everything they have already told someone has been either lost, forgotten, or the individual doesn't care because they're asking all of that information again. Instead of building on the fact that, I know that you said such and such. Is that still true? Is there anything you want to add to that? Do you remember any more about that? To play back to them the fact that you did hear something from them previously and you are in fact building upon that. Providing customized material. Don't provide the same information to someone who's been a diabetic for 20 years to someone who's newly diagnosed. And making that all-important first impression a wow. Because if that is a wow, then it makes any subsequent slip-ups seem less significant, we have found over and over. And ask me how I prefer to receive information. Do I want to receive it online, in print, both, through a text, through an email, something that I can share with a family member? It may be as simple as that. The key steps in simplifying communications are these. Respecting your audience, being relevant. Once you have done that audience analysis, you know what you want to say and what behavior you want to encourage. That will guide your content. And I cannot overemphasize the need for clear organization, something that is an intuitive, logical structure and prioritized from summary to detail will allow people to peel off at whatever point they feel they have received the information that they need. Obviously, the use of plain language, engaging, people with familiar words and speaking to them in an active voice so it is clear who is doing what to whom. Using visuals instead of words or in addition to words to accommodate different learning styles. We find over and over that there is a need for both, an audience for both, and therefore something that uses entirely pictograms is probably going to fail, as will something that uses only text. And revision can be extremely important. Doing validation research and then revising based on what you have learned so that you iterate to an improved, truly useful document. And it is very important to test both comprehension and perception of clarity. You may ask people if it is clear, credible, relevant, useful, engaging, and they may say the information is. But you need to validate that they understand what action is required, what the key information is, what the purpose of this communication is, to provide some kind of a task or some kind of yes, no answer that you can validate so that you understand whether in fact they truly did comprehend the information. This can be online, it can be small scale usability testing, probably not focus groups for most information, but it needs to be something that is an integral part of the development process. So if you believe that there's an opportunity in your organization to clarify, to simplify, to make the patient experience better, how do you get it done? You'll have to begin by finding an executive champion. Top management must drive, live, and fund simplicity. And it will mean working across functional silos. Legal and compliance, tech and operations, marketing, subject matter experts, and digital all need to come together so that they are, from the outset, sharing a common view of the audience in that very important empathetic stage, so that any obstacles, challenges, roadblocks can be expressed and overcome from the get-go. We also believe in using simplicity as a vaccine rather than as a cure. It is very hard to edit your way to simplicity. If it is possible to reduce the number of choices, clarify the distinctions, and then communicate them, you have a greater likelihood of achieving clarity. Also, defining what strategy you're trying to achieve from the outset. For example, are you happy as an organization with what we'd call a +1 level, where you have clear, inviting information, plain English text, and clear design? Or do you want to go to a level 2, education upon request, where you provide examples and scenarios, more customized content, but it's more available to the person who seeks it, versus level 3, the advice level, where you're pushing out the information, providing alerts and interactive tools, and completely customized content where you're using what you already know about the individual to tailor the content to them. It's also important to create limits. Resist that proliferating product variation. For example, we've worked with hundreds of financial companies who literally have 75, 100 versions of investments. And those options are simply too many for any agent, broker, or individual to process and understand. And over, we find the unfortunate approach that the ones who complicated information to begin with are not the people to simplify it. So it's unfair to go to your legal department and say, make this a clear and inviting, understandable agreement or contract or bill. They are unlikely to do that because they're in the business of having to protect their organizations, and they spend much more time in that realm. So, for example, Philips went outside and created a simplicity advisory board, and they brought in a fashion designer. They brought in people who had expertise from very seemingly unrelated fields to provide that perspective. And that leads to a better way. And that way is sometimes characterized as design thinking, this empathy, distillation, and clarity culminating in a prototype, where you bring that all together and then test and refine that by going back to customers to validate the approach you are taking and use that as guidance to then do revisions before implementation. But whatever you call it, that kind of process is very applicable to healthcare communication as well. Hundreds of our clients have found a better way to communicate by streamlining processes, blueprinting the process that underlies the information, customizing and making the content more relevant, writing in plain language, and making more powerful use of online capabilities. At this juncture, we have some time for a few questions. If you would like to submit them, you can type them in. I believe we have one question here about which healthcare communications are most in need of simplification? In my opinion, hospital discharge instructions would be an area that has had very little work done on it and is of critical importance, both because the reimbursement is often affected when facilities have to readmit someone. In other cases, of course, it simply will help patients. I would also say medical and dental bills and the EOBs associated with them are badly in need of simplification. Many of the admissions agreements that we were talking about and treatment guides, all of those I think are areas that in most circumstances would benefit. We have another question here about the role of chief experience officers and chief nursing officers who oversee patient experience. And it says here, but do not bring physicians into the mix to discuss the culture and the strategy. What are your thoughts on physicians taking a larger role in the patient experience? I think in the best institutions, physicians have a critical role to play there. At the Cleveland Clinic, for example, the fact that the physicians leave their business card on the table of a patient so that they can contact them directly if they feel after they've left that they didn't understand or they were under the influence of medications and couldn't take in what was being told to them. Keeping the primacy of physicians in this experience is very important. So I think that physicians also are feeling a lot of frustration with the fact that very often they're tied to looking at a computer screen now with medical, electronic medical records, as opposed to being able to spend more time in conversation with the patient directly. Another question about how have you succeeded at persuading top executives and attorneys that simplification was essential? What convinces them? In every industry, we have found there's much more of an objection in the abstract to simplification, particularly by legal teams. What persuades them is understanding what their concern is and then showing them how you plan to address it. For example, if they raise the objection that something has to be emphasized because of a regulation, they may say it has to be an all uppercase type, or it has to be 10-point or larger. But in fact, if you look at the regulation together, you may find it simply has to be more prominent than other information. And if you can work jointly and show how that can be achieved, often that objection can be overcome. Or in some cases, you may provide the legalese as it is, but then have a running sidebar, either online or in a printed agreement, that points out the sort of salient points that a reader should be taking away, almost like a voiceover next to the information. And very often legal teams are happy with that because they have the version they feel they need and the reader has the version that they need. Another question, have you seen any improvement in hospital patient satisfaction scores, HCAHPS, after simplifying patient communications? This is an interesting one because I can't say that we have seen that direct correlation. It has a lot to do with the fact that the HCAHPS, in my opinion, have some unfortunate wording in the patient satisfaction questions that they ask and the scoring methodology that they use. So it is very hard to attribute specific changes sometimes to those scores. So no, I can't draw that direct correlation. We also have a question about, are readability formulas useful and do you use them? Readability formulas are a great first line of defense but they are not a substitute for communications experts. They can certainly guide people as to the areas. It can sensitize a communication staff to where their writing may be overly verbose or lengthy, etc. But I view it as sort of an 80-20 rule. It can help you to solve a certain percentage of issues, but then you will need to go in and have an expert really evaluate all of these contextual issues that we're talking about to really change the experience. Another question about how do you see this applying to virtual care programs and the respective patient experience, such as teledoc? Regardless of the media, I believe most of these principles would be very true. In a virtual care environment, it depends on whether we're talking about using chatbots in certain circumstances, whether we're talking about using telemedicine where there's real-time interaction. So, there's a lot of parameters there. But this notion of anticipating and understanding actual context would seem to me to be as applicable. Another question, how would you describe the relationship between simplicity and brand experience? Well, we believe strongly that the experience should reflect the brand purpose, the brand values that you have expressed as a company. So if as a company you express a brand attribute of being easy to do business with, of being clear, transparent, etc., then simplicity would be absolutely critical and paramount. In certain circumstances, if that's not something you're promising that you're a company that is technology that is right out of the gate, that's going to be highly buggy, but it's going to be so innovative, maybe some of this is not quite as relevant, but in most cases, it should be an expression, a way for people to really live your brand. So I think there's a very close correlation. Have you compiled data that enables you to demonstrate the return on investment of plain language and simplicity? We have not, but many of our clients have. Many of our clients, of course, don't want to divulge that publicly, but a few examples. When we worked with the IRS, they tracked very carefully whether they, after we had simplified letters and notices for them, whether they were in fact getting speedier payment, and they were getting more people going onto installment agreements, which was a very desirable outcome in their view. In other cases, it's resulted in fewer customer service inquiries. And in some cases, the ROI has been unexpected. For example, when we worked with an insurance company, they were required by law to send an impending cancellation notice, and in fact found that when they changed the wording in the cancellation notice, they didn't lose those customers who previously erroneously thought that they didn't want to keep them as customers and who had gone to look to other carriers. So it can take many different forms, but yes, there certainly is an ROI, and there can be very many benefits to the employees of a company. When there are too many distinctions, too many choices, companies are hard-pressed to sell all of those variations. So they will find that their product suite is consisting of only 5 or 6 offerings, and in fact, the rest are languishing. So it can have many different dimensions. I believe that's all of the questions I see at the moment. I thank you all very much for participating. You see my contact information here on the screen. I hope you'll follow me on Twitter and certainly contact me either by email or in person if you're in New York and you would like to come in to meet with us. And I hope that you'll all take away from this something that you can apply in your day-to-day communications. There may be another question here. Will we be sharing the deck? Yes, we certainly will be. And I also appreciate the thank you.